Thank you, Dan. So we're ready to commence. Dan? Good, thank you very much. First of all, welcome to this meeting of the Health Committee. I'd like to begin by welcoming those members of the public and the press who are watching on live stream of this meeting via the Council's website. Due to the government guidance on social distancing, this meeting is being held remotely in accordance with the provisions set out in the local authorities and police and crime panels, coronavirus, flexibility of local authority and police and crime panel meetings, England and Wales, Regulations 2020, and with Cambridgeshire County Council's own virtual meeting protocol. A decision summary and minutes of the meeting will be produced in the usual way, and a recording of the meeting will be available to view on the meeting page of the Council website. To enable the meeting to run in an orderly manner, I would ask all members of the committee to keep their video cameras switched on for the duration of the meeting and to keep their microphone muted, except when I invite them to speak. Officers will join us to introduce their reports in the usual way. Any members wishing to ask questions or make a comment should indicate this by clicking the raised hand function on the right-hand side of the screen. When I invite you to speak, please unmute your microphone, ask your question, and then mute it again to allow the officer to respond. There will be no points of order or points of personal explanation. As with all new arrangements, especially those involving new systems, there is always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Please note that to facilitate discussion, I intend to waive the committee procedure rule limiting members' contributions to 5 minutes. I also propose to allow members to speak more than once on each item if appropriate. However, please make sure that your contributions remain concise and to the point. I would remind members and officers that all virtual meetings will be recorded. Right, if we can move from that to the attendance. Members, I will begin by calling the names of all members of the committee to establish your presence. Please unmute your microphone and confirm your presence when I call your name. Councillor David Connor.
He hasn't joined us yet, Chair.
Thank you. Councillor Lorna Dupre.
Present.
Thank you. Councillor John Gowing.
Present.
Thank you. Councillor Linda Harford.
Present.
Thank you. Councillor Linda Jones.
Present.
Thank you. Councillor Lucy Netzinger.
Present.
Thank you. Councillor Kevin Reynolds.
Present.
Thank you. Councillor Mandy Smith.
Present.
Thank you. And Councillor Susan van der Ven.
Present.
Thank you. And may I also go to the list of our district council representatives from East Cambridgeshire, Councillor Ambrose Smith.
Present.
Thank you. From Finland, Councillor Clark.
Present.
Thank you. From South Cambridgeshire, Councillor Harvey.
Present.
Thank you. From Cambridge City, Councillor Massey.
She hasn't joined us yet, Chair.
Thank you. From Huntingdonshire, Councillor Taverner.
Yes.
Thank you. And myself, Councillor Chris Bowden. Move on to agenda item 1, apologies for absence. Would Dawn please report any apologies for absence?
We have apologies from Councillor Hudson. We have Councillor Gowing substituting.
Thank you very much. Move on to item 2, declarations of interest. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? Please raise your hand if you do. Councillor van der Ven, yes.
Thank you. It's a I simply wish to disclose that my son works at Addenbrooke's now and I have alerted member services to the change I wish to make on my register of interests.
Thank you. I think it's very helpful for that to be recorded, but it doesn't look at all likely that it would cause any difficulty in your participating in any part of today's meeting.
Thank you.
Any other declarations of interest from anyone? If anything occurs during the meeting which causes any member to realise they should make a declaration of interest, would they please do so immediately? Thank you. Move on from that to agenda item 3, which are the minutes of the meeting on the 23rd of January 2020. We are being asked to approve the minutes of that meeting as a correct record. May I ask any member who does not agree with this proposal to click the raised hand function on the right of your screen now? I see no objection to the proposal to approve the minutes as a correct record, so as long as no one objects, we will take that as being carried. Thank you. Move on to agenda item 4, which is the action log. An updated action log was included in the published papers for this meeting. Officers, do any officers have anything to add to the action log, first of all?
No.
No.
Complete.
Right. Do any members have any questions on the action log? And if so, would they use the raised hand function on the right of their screen now to show this? Any comments from members about the action log? No comments or questions from members? Good. So since no members have indicated they wish to speak, I suggest that we will take the action log as being noted. Thank you very much indeed, members. We can now move on to agenda item 5, which is petitions and public questions. Well, members, we have received questions from 6 members of the public. The committee procedure rules set out in the Council's constitution limit the number of public questions to 3 per agenda item and 1 question per person. Given the unprecedented circumstances in which we find ourselves, I, as chairman, have exercised my discretion and accepted all of these questions. Each question will be read out by the Democratic Services Officer. All of the responses will require joint work from officers in the Public Health Directorate and other council directorates, such as Adult Social Care, and some also require input from NHS organisations. To collate full responses will take some time. However, each question will be responded to individually within 10 working days of the committee in accordance with section 4.4, paragraph 9.2 of the Council's constitution. But because 4 of the questions refer to care homes, the Director of Public Health will also now provide an overview of the local system in place to support care homes. Liz.
Okay, thank you, Councillor Bowden. So providing this overview, the Council's Adult Social Care and Commissioning Directorates are absolutely focused on supporting local care homes at this difficult time, working very closely with the Cambridgeshire and Peterborough Clinical Commissioning Group, NHS Community Services, and Public Health England's Health Protection Team. And these measures include regular contact with and risk assessment of care homes by the Council's Adult Social Care Commissioners, a daily care home call chaired by the CCG's chief nurse, involving adult social care and commissioning, CCG infection control nurses and NHS community services. And that discusses care homes with outbreaks and agrees actions to be taken, including care home visits. There were recently agreed standard operating procedures between the East of England's Public Health England Health Protection Team, the CCG, and the local authority. Public Health England provides the initial advice and testing to a care home with a potential outbreak, which is then followed up by the local NHS and social care system, with re-escalation to Public Health England if required. Where care homes have been unable to source PPE through their own normal suppliers or are waiting for a delivery, an emergency PPE supply can be made available from the local resilience forum, and support with staffing is also provided. There's a regular provider forum where information and advice is provided to care homes and questions can be raised. and a regular newsletter to care homes which shares the latest advice and guidance. And regular updates on the care home situation are provided to the local resilience forum, tactical coordination group, which is multi-agency, through adult social care commissioning membership. National guidance and strategy for care homes is regularly updated based on the latest research evidence, and we work closely as a Cambridgeshire and Peterborough system to implement this. Information on deaths in care homes by local authority is now published weekly by the Office of National Statistics, and Public Health England have just started to publish data by local authority on the overall number of care homes and the percentage which have experienced a COVID-19 outbreak. So that's just the overview of the work that's going on across the system in Cambridgeshire and Peterborough to provide support at this difficult time.
Thank you very much, Liz. It is important to remember that the response to COVID-19 includes many different agencies and partner organisations across the county and nationally, and that issues raised in questions may not be within the direct remit of the Council's Health Committee. Where that is the case, officers are ensuring that the questions are responded to with input from the relevant agency or are presented to the relevant Policy and Service Committee for a fuller response. We do have in agenda item 6 a COVID-19 update, and there will be questions following that. I just want to ensure that there are no comments that anyone wishes to make directly relating to the questions which have been raised by members of the public before we move on to the COVID-19 update, where there will be a more general opportunity for all members to ask questions. If anyone does wish to speak right at the moment on something very specifically to do with the questions which have been asked, then please do so, otherwise we will move on. Please raise your right hand if you do wish to speak. Councillor Van der Ven.
Thank you. Would it be possible, please, to circulate the questions to the committee so that we can see the detail of them?
My apologies, I thought that had already been done. Councillor Jones, I see that you wish to speak.
Sorry, I thought what you said at the start, Chris, which I very much welcomed, was that that Dawn was going to read those questions out. And I think that would be extremely helpful. I was then a bit surprised that we went straight into a kind of response to questions. I assume a response to questions anyway, without anyone having read the questions out. So could we have those read out now, please?
I do apologise, Linda. Yes, I should have invited Dawn to read out the questions, if not for the benefit of members of the committee, for members of the public who may not have been sent the questions. Dawn, are you in a position to read out the questions which were the 6 members of the public sent to us?
Yes, Chairman. The first question is from Ms. Hilary Cooper, and she says, I have read the paper on COVID-19 prepared for this committee and would like to submit the following question in relation to paragraph 5.1.8, subsection on risk that COVID-19 spreads within residential institutions with vulnerable populations, e.g. care homes, prisons. Please would you provide a statement on the following? A, the latest figures for the number of COVID-19 related deaths in Cambridge care homes, broken down weekly if possible. B, whether these appear to be spread across care homes or clustered in a smaller number of homes. And C, the total number of care home residents in the facilities for which you have data on deaths. The next question is from Mr. Simon Sarita, and his question is, please would you provide a detailed response on the mitigating action in relation to this, including A, what specific measures are being taken to ensure regular testing of all care home staff, given many may carry COVID-19 asymptomatically, to prevent spread of infection to vulnerable care home residents? B, what measures are in place to guard against the risk that people discharged from hospital into care homes may inadvertently be spreading infection? And C, what is your assessment of the adequacy of the PPE equipment in care homes, and can you give an update on how this is being deployed? The next question is from Ms. Mariah Mackay, and her question is, what assessment was made of the risk arising from the policy of discharging hospital patients tested positive for COVID-19 into care homes? Given the inevitability of its rapid spread among elderly, vulnerable residents, what public health actions were taken to mitigate this policy's impact in Cambridgeshire, and with what degree of success? The fourth question is from Mrs. Anne Campbell, and her question is, how is the county coordinating their efforts with the government's testing programme for COVID-19 in devising a strategy to prevent the virus spreading in the county's nursing and care homes? How many COVID-19 related deaths have occurred in the county's nursing and care homes? The next question is from Mr. Frank Gawthorpe, and his question is, the report discussed vulnerable groups but makes no mention of those adults with learning disabilities who are the responsibility of the County Council through the Learning Disability Partnership. I am particularly concerned where a number of individuals are in a group accommodation, such as my nephew, for whom I am the next of kin, who is in a supported living home supervised by Royal Mencap. I'm concerned that this vulnerable group should not be overlooked, as they may need additional support to understand the gravity of the position, and that the care staff and residents in such group homes need to be provided with sufficient personal protective equipment. Can I be assured that this matter is being addressed? And the last question is from Mr. Robert Lawson. I write as Joint Secretary of the Accordia Community and Residents Association, which has been involved in a limited way in efforts to support local residents in response to the pandemic. I would be grateful if the following points could be put before the Health Committee meeting next week. The paper focuses very much on procedural and institutional issues, and the 3 challenge areas listed are generic ones. What specific problems and challenges have emerged as most important for Cambridgeshire citizens and businesses, for example, through contact with the COVID-19 Coordination Hub, and how has the County Council responded? Second, as an obvious gap in the challenges identified in the paper is the fall in patients being treated for other conditions. How serious is this in Cambridgeshire, and what is being done in response? What other non-COVID-19 impacts have been identified? For example, the effect on nutrition of greater reliance on food banks for some people. Thirdly, we note that calls to the Council's call centre are discouraged, and although phone numbers are given in some of the sections of the COVID-19 pages on the website, there is no general helpline. For residents who are happy to use the website, the material is badly organised and often amounts simply to a series of links to other sites. We have looked as an example of good practice at the Surrey County Council site, which, for example, prominently shows a helpline operating every day. What action is being taken to improve communication with residents, particularly those who are less proficient with online tools, or who might not even be happy to use the phone and who need face-to-face or hard copy communication? A well-publicised, adequately resourced helpline can be cascaded through organisations like ours to reach most residents. And lastly, presumably there are elements of the Council's labour force that are under-occupied at present. What scope is there to redeploy them to provide support on COVID-19 related issues, possibly working with volunteer groups? And that's all of the questions.
Thank you very much indeed, Dawn. That was extremely helpful. As was quite clear from those 6 questions, all of them do involve other committees apart from the Health Committee, which is the reason for the necessity of getting joint work involved from other officers to give assistance in providing those answers. And those answers will be provided not merely to the individuals who asked, but will be provided also to all members of the committee so that the answers can be seen. Councillor Netzinger.
Thank you. So several of those questions refer to things that I had already wanted to raise under the COVID report. And I just wanted to say at this point that I will come back on lots of those questions, but I think it's probably easier if we do it under the report rather than now. It doesn't mean that we're not paying proper attention to those questions, which are absolutely excellent questions.
I completely agree with you, Councillor Netsinger. I think it's really helpful to do all of this under the COVID-19 report. Obviously, those elements which are not to do with the Health Committee may not be able to be directly answered, but to the extent that the items do relate to the work of this committee, then Liz will be able to provide us with an immediate answer. So with the agreement of members, we will now move on to agenda item 6, which is the COVID-19 update. Officers have been asked to bring a report on the COVID-19 response to date for those services for which each policy and service committee is responsible. A similar report will be brought to each future meeting until further notice. Given the rapidly changing situation and the need to provide the committee and the public with the most up-to-date information possible, I have accepted this as a late report on the following 2 grounds. First of all, the reason for lateness to allow the report to contain the most up-to-date information possible, and secondly, the reason for urgency to enable the committee to be briefed on the current situation in relation to the Council's response to COVID-19 for those services for which it is responsible. The way in which I'd like to proceed with this is as follows, with the agreement of the committee. I'll ask, first of all, the Director of Public Health, Liz Robin, to introduce the report. Then I would like, first of all, to go to questions from Councillor Susan van der Ven, because she has already provided written questions to officers, 9 or 10 of them. And my proposal is to go to those written questions that Councillor van der Ven has provided, which I will ask her to read out, and to give Councillor van der Ven the opportunity to ask questions about those particular items. I will then open the meeting up to other members to ask questions. So to start off with, may I ask the Director of Public Health, Liz Robin, if she'd care to introduce the report, please.
Right. Thank you, Councillor Bowden. And I'd actually like to start with something which isn't in the report, because we have done the analysis since the report was written. But I would like to really thank local residents for the way that they have listened to and responded to the government stay-at-home rules. And the reason why I say that is that we are now able to do more analysis of the very sad death rates by local authority from COVID-19. And every death from COVID-19 is a tragedy. What we're seeing in Cambridgeshire and Peterborough is that our death rates are relatively low compared to the national average and to the regional average. And some of this can be put down to Cambridgeshire and Peterborough being relatively far from London, which had high rates, and also to the rural nature of the area. But I think it can also be put down to the way that every local resident has behaved, because in this pandemic and with this infection, it is what the community does that makes the biggest difference. What we do as public services is important, but it's what the community does that is most important to prevent the spread. And I think that the community in Cambridgeshire and Peterborough has really stood up to that challenge. And that is reflected in some of the figures that we are now getting through. Although we are at a very early stage, and clearly we need to see how this progresses. So I don't want to be say too much too early, but I think it does reflect a community that really has listened and done the right thing. And as circumstances change, I very much hope that we are able to continue with that across the area. So that is kind of outside of the report, but it's important because it is the most important measure that we have. And it's because the communities have behaved in the way that they have, that our NHS is not overloaded, and our NHS capacity in Cambridgeshire and Peterborough has been able to cope throughout, certainly to date, and has had beds and has had intensive care beds available. So that's positive. The next thing I'd like to say, which does move more into the content of the report, and I'm focusing on section 5, the service response, because that is the section with which is most relevant to this committee. We have worked very much in partnership as a system across the public sector in Cambridgeshire and Peterborough. That is described in the report, the way in which we come together through the Local Resilience Forum. And at the most senior level, the Strategic Coordination Group, which is jointly chaired by Gillian Beasley, our Chief Executive, and Jan Thomas, the Chief Executive of the Clinical Commissioning Group. So a lot of public health work has been across the system, with public health specialists working in partnership, both within the council and with organisations outside the council, to offer specialist public health advice and support. And we do that at all levels, to the Strategic Coordination Group, to the Tactical Coordination Group, which is also multi-agency on day-to-day delivery. And more recently, we have set up a public health advice cell as part of the Local Resilience Forum, which includes our own specialists, but also input from a public health specialist at the Clinical Commissioning Group in the NHS, and direct input from Public Health England. So that group will continue to provide advice across the system. We provide internal advice to other council directorates and to the Joint Management Team and Tactical Working Group. We have a public health consultant who specifically works with the People and Communities Directorate, because there is a lot of needs for advice in adult social care, children's and so on. And we provide direct advice to council staff through an Ask Dr. Liz email helpline. We also are working with the Community Reference Group, which is a multi-agency subgroup of the Strategic Coordination Group and chaired by Adrian Chapman, our Directors of Community and Safety. We're working very closely with that group and the Community Hub on a stock take of the current situation and its impact on vulnerable and socially excluded groups. And that's jointly led by the Office of the Police and Crime Commissioner and by Val Thomas, our Deputy DPH for Cambridgeshire. Our Public Health Emergency Planning Officer is working with the Community Hub to support implementation of our Vulnerable Peoples Protocol, our multi-agency protocol, which helps with information sharing. And we've also helped develop guidance for volunteers on public health issues. Another member of our team who's at the meeting today is co-chairing the Cambridgeshire and Peterborough LRF Personal Protective Equipment Cell, that's the PPE cell, which receives PPE from the national stockpile, and where local organisations, including care homes, have interruptions in their supply of PPE. They do try first to source it through their own routes and other national routes, but where an urgent supply is needed, that is supplied through the LRF PPE cell. Our public health analysts are involved again with the LRF intelligence cell, working on modelling, and increasingly they've been able to work on the national statistical releases from the Office of National Statistics and other bodies as those increase at local authority level. Our public health commissioners are working with our services, which are normally the main business of this committee, such as our integrated lifestyle services, sexual health services, drug and alcohol services, health visiting services. We're continuing to work with them on the adaptation of their work through COVID-19 and changed ways of working, and also to make changes in terms of some contracts that we were expecting to transfer at around this time, but clearly now is not the best time to implement new services in the current situation. So we've worked collaboratively with providers in order to extend contracts and ensure we follow the right procurement routes. We also have a public health consultant who's working very closely with GPs, the mental health services, and with the mental health voluntary sector to increase the offer around mental health, which is very much needed at the moment, and working with our communications team around the Mental Health Now We're Talking campaign. And we work regularly with the media team on other communications with the public. We maintain our links with the East of England Public Health England team, and call into a number of their teleconferences to make sure that we stay up to date with the latest information and guidance that's coming down in relation to public health and the COVID response. And we will also attend multi-agency incident meetings in the local area where appropriate. So risks and mitigations, these are always quite difficult for public health because we look at the public health risks across the whole system, and those risks often require a much broader response than the services that are under the remit of the Health Committee. So the risks that we are particularly focused on are around not all population groups having access to an understanding of our messages and guidance. And I've talked about how well local residents have responded to the stay-at-home guidance, but we work a lot with both communications colleagues and our diversity lead, who's based in Peterborough, to ensure that we are translating, getting communities involved, making sure that everybody has access to this information. And we work with the wider Warn and Inform group across agencies on that. And that's very important. The risk that socially excluded or vulnerable population groups may find it hard to socially distance or find other things hard is addressed through the stocktake that I talked about, jointly led by Val Thomas and the Office of the Police and Crime Commissioner. And the risk of spread within residential institutions and care homes we have already discussed, but also prisons is something that we need to keep a close eye on. We work closely with others on that risk. Locally as nationally, PPE remains a challenge, and having effective work by the local LRF PPE hub does help to mitigate that where there are urgent needs. We were planning for the peak of the pandemic, clearly nationally. That has now passed. In Cambridgeshire and Peterborough and East of England, it's been a bit more of a plateau, but we think we are just beginning to see that coming down. We haven't had the same big peak as in London. And a challenge going forward, which was very much on the news last night, will be to work through a national, regional, local system to increase contact tracing. So the testing has been ramped up, but we now need to track and contact trace people who've been in contact with cases. So that's a big piece of work going forward. And clearly another big piece of work will be around a move, which I don't say as a move to recovery, because that sounds as if everything's going back to completely to normal, but a move to a new normal. Increasingly, there is work to prepare for that. Although at the moment, the transmission rates are still such that the stay-at-home guidance is in force and really important, and I hope we can maintain that. So I have talked a bit more than usual, but it's a while since we've met, and I think it's really important to go through all the partnership work that has been going on in the response to this very difficult situation for everyone.
Thank you very much indeed, Liz, for this for the flood report. It is an unusual situation. It's a very unusual report, and it's more than justified that you did spend rather longer than usual in introducing it. I do plan to ensure that every single member gets the opportunity to ask whatever questions they wish during the course of this debate, and we'll ensure that you will get that opportunity in order. But first of all, I would like to invite Councillor Van der Ven to ask her questions, given that she's already given us written notice in advance of these questions. Susan, would you be kind enough, please, to... Oh, sorry, Councillor Dupre, do you wish to speak now? Oh, you're just getting in early to make sure that you're the first. That's very well done. You've obviously got more practice than many in terms of how to use the Zoom function. So, Susan, if you'd be kind enough, please, to read out the questions that you asked in writing earlier in the week, and then I'll invite Liz and any other officers who wish to respond to that. We do have with us Linda Sheridan, who's joined the meeting, who is the co-chair of the Local Resilience Forum PPE cell. So Linda may be in a position to answer some of the questions from some members at various points. And I know that Val Thomas, who's looking particularly after the shielded population, may be able specifically to answer questions about the shielded population. But Susan, if I may ask you to ask your questions.
Thank you very much. Yes, I will include the preface to my questions, which I included in the email. In recent weeks and days, in reaction to reporting on deaths in care homes and the discharge of untested patients from hospitals into care home settings, understanding the behavior and future prospects of the COVID-19 pandemic has shifted to the care home setting. It is increasingly recognized that care settings hold a key to managing or failing to manage both the current outbreak as well as a second wave of infection. We welcome the greater focus on and sharing of information detail by the CQC and reassurances in the County Council COVID-19 highlight reports on attention to PPE and testing in Cambridgeshire care settings. However, greater clarity is needed and should be expected, certainly in the context of the County Council's overarching responsibilities for social care, public health, and health emergency planning, in order to establish confidence about the protection and safety of vulnerable people, their carers and care home staff, and those who come into contact with them, and also in the wider domiciliary care setting and the communities that surround them. So it is in this spirit that I would like to pose the following questions. First, Cambridgeshire data about discharges from hospital into care homes. Is the County Council informed as to how many patients have been discharged from hospitals into care homes to make space for COVID-19 patients? Do we know how many of those were tested for COVID-19 before being moved? How frequently is that information collated? Please provide the figures. That was just one question. Number two, Cambridgeshire data about capacity in care homes. What was made available when and how much of it has been occupied? 3, numbers of tests made available, carried out, and when by week. How many have been positive and what action has then followed? Number 4, care home death data by week and comparison with the 5-year average. Number 5, how is the above data shared between the NHS, the County Council, and care home owners and managers? Number 6, PPE information, specification, supply, and adequacy. Care home PPE includes an apron rather than full gown. While this may meet PHE requirements, is this considered by care home staff and public health officers at Cambridgeshire to provide sufficient protection? What about face shields? And what PPE is provided to non-patient facing staff in care homes? Number 7, protocols for care workers moving between homes and between patients. Do care workers move between care homes and or between care homes and private homes of vulnerable adults? What is the protocol for changing PPE between seeing each patient, and how is this monitored? Number 8, care in people's own homes. How is that being managed and how are issues reported? Number 9, sharing information about COVID-19 infection and deaths of residents and staff in care homes and domiciliary care settings. What are the County Council's protocols for sharing information with staff, members, and the public? Are local members informed? And I should just add that since I submitted my questions, I've had the opportunity to read this week's COVID highlight reports, and the commissioning report does acknowledge a variety of views on some of these PPE questions that I've asked. And I have also had the opportunity to read the Public Health England How to Work Safely in Care Homes guidance, which was revised on the 27th of April. So thank you very much for listening.
Thank you very much indeed, Councillor van der Ven. And thank you for providing those questions a few days in advance in writing to give an opportunity for them to be looked at and considered carefully. May I invite Liz Rubin, the Director of Public Health, to respond in the first instance to those questions?
Okay, thank you, Councillor Bowden. So Councillor van den Ven, they're very good questions and comprehensive. For your first question about discharges from hospital into care homes, the information about discharge from hospital and destination of discharge is held by either the NHS or adult social care colleagues. So I will refer this question to adult social care colleagues who will be able to give you some of this information. More generally, the national guidance for hospitals states that all care home residents will be tested on discharge before they are admitted to a care home. And the national guidance for care homes takes this into account and includes guidance for isolation and infection control for residents when they are discharged. So your second question about capacity in care homes can also be answered by my adult social care colleagues, and I will ask them to pick this up. Your third question is about testing of care home residents, and testing of symptomatic residents when an outbreak first occurs is coordinated and requested by the Health Protection Team from Public Health England through teams commissioned by the NHS. And the NHS Clinical Commissioning Group can also commission testing. So data on testing of these residents would be held by these organisations, and I'll refer your questions about the data to them. Testing of symptomatic staff has been coordinated by the CQC or by referral through the Government UK website. And when a care home resident has symptoms and is tested for COVID-19, they would be presumed to be positive at that point, rather than waiting for the test result. So the care home would be advised to isolate the resident and use appropriate PPE and infection control measures as set out in the national guidance for care homes. I would just say about testing that this is a rapidly increasing and changing landscape. So what I've said is correct for what has been happening. It is expanding in terms of remit. Your fourth question was about care home deaths and how deaths in recent weeks have compared with 5-year averages. We have used publicly available Office of National Statistics deaths information to look at this, which includes deaths up to the 17th of April, registered up to the 25th of April. We have a comparison with a 3-year average, which is what had been used before, 2017 to 2019, rather than a 5-year average. Basically, the data shows that for the year until 27th of March, the numbers of deaths that took place in care homes were similar to previous years. And I note that your question asked about all deaths in care homes. It wasn't about deaths coded on the death certificate to COVID-19, but all deaths. So in the week beginning 28th of March, there were 34 deaths in care homes in Cambridgeshire compared to a 3-year average of 26. In the week beginning the 4th of April, there were 44 deaths in care homes compared to a 3-yearly average of 22. And in the week beginning 10th of April, there were 66 deaths in care homes compared to a 3-yearly average of 21. However, only 19 of these 66 deaths in care homes were identified on the death certificate as being from COVID-19. And I would say that these are not deaths of care home residents that might occur in hospital. These are only deaths that actually occur in the care home. So we have some preliminary work comparing areas in the east of England in recent weeks, which indicates that the rates of death in care homes in Cambridgeshire overall are similar to or possibly lower than other areas. So what we are seeing is very much part of a national and regional picture, but clearly of concern, and a huge amount of action being taken to address this and to support care homes. Your fifth question was about how data is shared between the NHS, the County Council, and care home owners and managers. The main response at the moment is operational. So care homes share information with the NHS and adult social care when they have symptomatic residents, so that the organisations can work together as well as possible to manage outbreaks, prevent infections, and support the care home. This is done through direct contact with care homes and daily calls involving adult social care and the NHS, including CCG infection control nurses. There is also a regular mail out from adult social care to care home providers, which provides information such as new national guidance for care homes or where to obtain PPE. Your sixth question was about what PPE is required, and the national guidance called How to Work Safely in Care Homes, which Councillor van den Ven mentioned that she had been able to look at recently, provides clear information about the PPE which is required. This includes different care and activity contexts and covers all PPE, including visors, masks, gloves, and aprons. Care homes and care providers have been supported in continuing to identify and source adequate PPE where they have had issues with sourcing enough of the right equipment from their own regular suppliers. And additional emergency supplies are accessible through the local Resilience Forum PPE cell. The use of aprons in care provision was something you asked about and is in line with national guidance and is consistent with guidance provided to healthcare workers both in and out of hospital. The only procedures where a gown may be required but would be what's called an aerosol generating procedure, such as complex tracheostomy care, which is more common in hospitals, but may occasionally be done in a small number of care homes. So staff in non-patient facing roles in care homes you also asked about, and they are included in national guidance and would be advised to wear a surgical mask with further PPE depending on the level of contact. In your seventh question, you asked about care workers moving between homes and between clients, and I will ask adult social care colleagues to supply you with the details of current services and protocols. The protocols for whether PPE needs to be changed between clients are laid out in national guidance from Public Health England, called How to Work Safely in Care Homes and How to Work Safely in Domiciliary Care. I will also need to refer your question about how care in people's own homes is managed and how issues are reported to the Adult Social Care Directorate for a full answer. I'm aware that they are very much in touch with and supporting the Council's commissioned home care services at this difficult time. Your final question was about protocols for sharing information about COVID-19 infections and deaths for care homes and domiciliary care services. The majority of this question will need to be referred to adult social care, who work with the care homes and receive information from them to deal with operational issues. More generally, as I've already mentioned, there has been significant progress recently on national publication of data on outbreaks and deaths in care homes, collected by the Care Quality Commission and the Office for National Statistics. And some of this information is now broken down to local authority level. So the Public Health Intelligence team are able to interpret and provide briefings on this. That answer was as comprehensive as we could manage within the time available, Councillor van den Ven, so I hope it's helpful. And we will be referring your questions on to the other directorates and organisations that can help to provide more comprehensive answers on some of them.
Thank you very much indeed, Liz, that was very helpful. Just to advise members, I'm going to be a lot more lenient than might normally be the case because of the importance of this issue in allowing members to ask supplementary questions to the ones they've already asked. And I will get to every member who's indicated that they wish to speak. I have Councillor Lorna Dupre, Councillor David Connor and Councillor Linda Jones at the moment. But first of all, I'm going to go back to Susan van der Ven to ask Susan if she wishes to ask any further questions to Liz as a result of that answer.
Thank you very much. Yes, I would like to ask three, please. Liz, you mentioned that in a care home setting, a suspected case of COVID, a resident with suspected COVID is treated as if with COVID and isolated with infection control implemented. Does that person still receive a test eventually after those protocols have been activated? That is one follow-up. I hope it makes sense. The next question refers to my question on PPE. I appreciate that Public Health England guidance exists, but my question is really about any difference of opinion as to the adequacy of that guidance. And I do note in the COVID highlight reports that were published on Monday, in the commissioning report, it does tell us that Infection Control disagree with Public Health England guidance and made that clear, that they have pushed back to Public Health England on the guidance. So I think it's that was what I was probing about in my question, and there has been some you know, a very frank and helpful mention of that in that report. And then finally, on my last question on the sharing of information, as a local member, and I'm sure my colleagues may feel the same, I was keen to include the question as to whether local members are kept informed about infection and deaths of residents and staff in care homes in their divisions. So that was part of that final question. And I understand that that needs to be referred to adult social care. And I just wanted to make sure that that aspect of my question is referred. Thank you.
Thank you, Susan. Liz, would you care to respond, please?
Okay, so on the testing, Susan, what I meant to convey was that if a care home resident has been tested because they have symptoms, the care home wouldn't wait for the result of the test before they put in place the appropriate isolation and infection control measures. So things wouldn't carry on as normal while the test result was awaited. The measures would be put in place straight away. The testing of care home residents has changed recently. Initially, when tests were in shorter supply, when residents were first symptomatic and the outbreak was first communicated to Public Health England Health Protection Team, a number of tests would be ordered at that point, but not every resident would necessarily be tested after that. They would be assumed, if they had symptoms, to require the appropriate infection control interventions for COVID-19. With the ramping up of testing, that policy has changed. So now you would expect all the residents to be tested. So I think that was also part of your question. So regarding the commissioning highlight report, I'm afraid I haven't looked at that, but Public Health England always ask for feedback on their guidance, so we often raise questions to them at regional level, and Public Health sometimes provides a channel for that. The Public Health England guidance is very carefully worked through and evidence-based, but we also have lots of skilled professionals in the system, and it's absolutely right that they should be able to challenge and ask questions. I'm not aware of any debate between the infection control nurses and the Public Health England guidance around the issues of aprons, which are used in both hospitals and care homes, which is what the specific point was about, though I'm happy to find out more. And I accept your last point, and we will ensure that that is referred on.
Thank you, Liz. Very helpful. Susan, would you care to ask anything further?
Thank you. I've used up far more than my fair allocation of time, so I will. Thank you very much, Liz.
Your time will be as open as the relevance of your questions, so you would be more than welcome to carry on if you so wished. May I ask officers to ensure that the written answers which are going to be sent to Councillor van der Ven are also supplied to all members of the committee? That would be really helpful if all members of the committee could see those. Thank you. And now move on to Councillor Lorna Dupre. And similarly to Councillor van der Ven, please, you will be given every opportunity to ask supplementaries, so don't feel you've got to rush this.
Thank you very much indeed, Chair. I've got a number of issues I wanted to raise. Do you want me to raise them all at once? Or
I'm very happy for you to do it one by one, get answers, I'll come back to you, and we won't go to the next person until you've finished.
Okay, thank you. My first query was on page 6 of the report, which was about the coordination hub and supplies of food to shielded and vulnerable self-isolators. I know a number of occasions, many occasions on which that's been very gratefully received, but equally there were teething troubles, and there are with anything, so you know, one's not going to make too much of that. But I think there are a number of people who are shielded, who very much would prefer to be able to do their own food shopping online, and are finding it enormously difficult to get slots. And I know of people who are having to stay up till 1 o'clock in the morning to grab precious slots for online deliveries. I wondered to what extent there was, how the liaison was going. I think there's data being shared with the supermarkets to enable them to prioritize people who can't get out physically to the shops. I wondered whether we could have any sense of how that was going and what plans, what representations we are making about enabling those people to resume as much of a normal life as they can in terms of doing their own shopping, rather than tying up volunteer effort, which is, you know, brilliant to have that volunteer effort, but there are a lot of people who would very much prefer to do their own thing if only there was the facility available. That was my first comment about how all of that food supply for shielded and vulnerable people is going.
Thank you very much indeed, Lorna. May I invite either Val or Liz to answer that question, whoever's most appropriate.
I'm happy to take it, Councillor Bowden, because Val is doing a lot of work with vulnerable groups, but isn't perhaps quite as directly involved in the shielded details of the shielded programme. Although Val, please chip in if you want to. I think we need to refer that question to Adrian Chapman, the Director of Communities and Safety, who is overseeing that programme and would be having those debates. He's and the community COVID-19 hub is very much involved in that whole issue of the food provided to shielded people.
Okay, thank you very much indeed for that.
Yes, thank you. Val, do you want to add to that at all?
I would agree with Liz's comment that it would be best to ask Adrian Chapman. There's been a lot of work on how food supplies are delivered to shielded people, and it's, as you alluded to, it has developed considerably, and it's ongoing development. So I think the best thing is to ask Adrian, because you have some particular questions.
Thank you.
Thank you, Val. Lorna, would you, Val, your microphone is not working particularly well. I don't know if you may need to volume slightly. Lorna, would you care to ask your second question, please?
Yes, there's a set of related questions around the provision of public health advice and guidance section at 5.1.1. Three things. Firstly, just wondering what data and reports the LRF and local health service and partners are preparing and publishing about the local situation. We were given some useful statistics there in Liz's previous answer about deaths in care homes, and there is a certain amount of information online, but I wondered whether there was any centralised data collection and sharing that was specifically about Cambridgeshire and Peterborough, and whether there was any analysis going on of that, and if so, how that was being made available and to whom. My second question about this section was whether we had any comments on what appears to be quite a differential rate of symptomatic infection in Fenland and Peterborough compared with other parts of Cambridgeshire. I'm taking that from the COVID tracking app, which is absolutely superb, and which I've been reporting on personally every day for weeks now, and encouraging everybody to do so. And it's really helpful in providing a lot of crowdsourced information about what's going on, and it tells you how many people are self-reporting in each district and what the estimated number of symptomatic cases is. in district by district. And at the moment, what we're seeing is that there are something like 2,500 people reporting regularly in my area in East Cambridgeshire, where there's a prevalence of there's about 0.5% symptomatic cases at the moment. Where you go over the border into Fenland, and we're talking about half the number of people using the app and responding to that, so about 1,200, 1,300 people, but a rate of symptomatic infection of something like, I think it's 1.5 at the moment. It was 1.7 yesterday, so significantly higher. And I wondered whether we had any comments on that. I know the leader of the council was reported a day or two ago saying that there had been a spike of cases in March. I'm not sure what he was basing that on, but certainly according to the tracker, which has a lot of users, it looks to be that the Fenland rate is considerably higher. And my third question on the whole public health and guidance section was, there's no mention at all in this report of urgent dental care, and I was wondering what was going on with access to urgent dental care and how that was working out, bearing in mind that because of all the spray and everything, it's probably one of the more high risk outpatient activities.
Thank you very much indeed, Councillor Dupre. Liz, would you care to answer?
Okay, so in terms of the Local Resilience Forum and the Strategic Coordination Group, there is a regular communication sent out from the Strategic Coordinating Group, which goes to all councillors. That's sent out at least once a week to provide the key points of the system response. This is an emergency response structure, so there is an intelligence cell which looks at information, but that is very much to guide the response. And I would say that in terms of analyses that provide information to the public, now that more information is available at local authority level, I think the Public Health Intelligence team will be increasing the extent to which they are able to analyse and provide information on some of that. But the Strategic Coordinating Group does send out a summary of all the key issues very widely, at least once a week, in a form that we hope is easily understood by the wide range of people and groups who receive it. There is a strong focus on communication. In terms of the app, I have to say that's not something which is much used at the moment by ourselves. It is obviously of a lot of interest, and for the people who use it, they judge their symptoms, they add it and so on. We do tend to use the information that is collected through, it has been through the hospital testing, and now the care homes as well. So we have tended to identify the most serious cases who needed treatment rather than the numbers of people with symptoms in the community, some of whom will have COVID-19, but not necessarily all of them, because there are other respiratory illnesses around. So I can't really comment on that, Lorna, I don't think, in any detail, but happy to receive more information on it. And could you just remind me of your third question, please, Lorna?
Urgent dental care.
Urgent dental. Yes, there has been a lot of work going on around urgent dental care through NHS England, and they have been working very hard to ensure that urgent dental care centres are set up and available. When I last looked at this, members of the public could understand where to get help through. I think through phoning their own dental practice and getting redirected is my understanding, but that may have changed because things move on. But I'm happy to supply you with the latest NHS England information on that, because NHS England has been publishing the plan and the updates.
Thank you very much.
Thank you, Liz. That is very helpful. Lorna, would you care to ask any supplementary or any further questions, please?
I've got supplementary questions and then some further questions. The first thing about data, I would be very grateful indeed to see more data, because I think there's now, as you say, Liz, a growing amount of data out there brought down to not just district level, but MSOA level data, and a lot of individuals are kind of combing through that to try and gather bits and pieces of what they can, and it would be really helpful if there was something more authoritative that brought and shared that data together. We're getting a lot of useful material from the County Council, 3 or 4 emails a day of various kinds, you know, and the data is something that is of interest, and I think it would be good to have that reliably rather than trying to comb through all the national stuff that's broken down in enormous spreadsheets. It'd be really good to have something centralized on that. The app I would recommend looking at, because I gather it's the biggest exercise of its kind anywhere, and it's very substantial in terms of numbers. It's King's College London one, and they've been doing webinars based on what they've been finding. It arose out of the Twins programme actually, and it's been really interesting, and a lot of data there, I think. So I will send information about that through. Sorry, next questions. PPE on page 9, we've heard a little bit about that already today. Just wondering how often local organisations have been having to resort to the Local Resilience Forum hub for that. And then my next question on that page, if I can do them page by page, was about tracing, contact tracing. What expectation do we have of the County Council and local NHS involvement in contact tracing? Because at the moment there's growing news about this app, rather questionable app that's going to be launched and being trialled in the Isle of Wight at the moment, and I wondered how much there was actually going to be local involvement in contact tracing rather than leaving it all to something digital like that, and what we were doing to gear up for that.
Thank you for those questions, Lorna. Liz, may I invite you to respond, and or Linda Sheridan, if necessary, on the PPE?
I'll actually ask Linda to respond on both, because she leads on PPE, but is also our representative in the work we're doing on developing contact tracing. Is that okay, Linda?
Thanks, Liz. Yeah, that's okay. Right, on the PPE, we have regular contact every day. There is, and it is a 7-day-a-week operation now. We have supplies of PPE going out to care homes, care providers, and others across the county and across Cambridgeshire and Peterborough. I wouldn't be able to tell you, how frequently each organisation is getting supply, but whenever they come to us, as long as they're not expecting too much, and because it is supposed to be an emergency supply, we are able to support them. So what they are told is that they are expected to continue to procure supplies from their usual sources if they can. They've also been given the details of the wholesalers recommended by Department of Health and Social Care, so they can go to those. But if they absolutely can't get through normal suppliers or through those suppliers, they are given a generic email address to contact, which will get them through to the LRF PPE hub and to put in an order. They're asked to make their orders in line with the Public Health England guidance, and for a stock for 1 week at any one time, because that allows us to maintain the stock. Once they get those orders in, they're turned around very quickly, and they should have them delivered the following day as a general rule. Occasionally they've been slightly slower than that, but certainly they're out definitely within 48 hours. We managed to procure a warehouse very early on, as soon as we knew this stock was coming. And we have help from Team Rubicam and Red Cross volunteers at the warehouse, who are picking and packing and delivering the supply out to care homes and others. We also have a small admin hub up there alongside, close to the warehouse, and they're actually collating it all. So the actual detail of how often, I'm certainly aware from because I cross-check a lot of the orders to make sure that they are in line with the guidance. So I'm aware of a number of care homes that have come to us on a number of occasions, but I wouldn't be able to say quite how many and how often they're coming to us. With regards to the moving towards contact tracing, it's still very early days. We've had a certain amount of information through to us at this stage, and we are aware that there will be three, or the implication is that there will be 3 tiers to the response in contact tracing. The first tier is the Public Health England specialist team. The second tier is expected to be public health specialists. And then there's a third tier, which is wider, which will be the big number that they're talking about recruiting nationally. I think the intention is that when somebody is reported to have had a positive test, they would be contacted probably by the tier 2. That's the public health specialist group. That's assuming it's not going through the app, but for the people that are being contacted directly, they'd be contacted through them. Information would be sought about their contacts, and that would be passed on to the tier 3 people, who will then make contact with their contacts. Sorry, far too many contacts. And advise them appropriately as to the action they need to take because they've had contact with a positive case. They won't, the people, the wider out level of contacts won't be told who the person they were in contact with is. So there will be anonymity involved. But that's about as far as we're on. We've got a group together. We understand that there will be, in terms of the local aspects of it, I think it's more likely to be on a regional basis rather than a local within county basis, because it's Public Health England will be bringing together the public health group that will be the first and second tier response. So I think it will be Public Health England, or obviously across the east of England. So I think we would be joining colleagues in other counties in the east of England to support that.
Thank you, Linda. That was very interesting and informative. Lorna, would you like to follow up on any of those 2 answers before you move on to your next question, please?
I think just to say that if there is any data on how often people are resorting to emergency supply of PPE from the hub, I would be grateful to receive that. I think that would be helpful to know. And my final 2 questions, you'll be glad to hear, relate to page 10. Firstly, we've heard quite a bit, and one of the public questions today was about local evidence of people not coming forward with significant and serious non-COVID related health issues. And that's something that's been flagged up nationally as being an issue, that there's been a large drop in numbers of people coming forward with stroke or cancer related queries or whatever. And I was wondering what evidence we had locally for what the picture was like in Cambridgeshire, and how we were expecting to marshal our resources, or the NHS is expecting to marshal its resources to deal with that. Which kind of leads on to my second question, and it's a request really. I wrote to you, Chair, yesterday about the letter from Sir Simon Stevens, which is about the next phase of COVID. It's a letter that's in the public domain that has gone to local authorities and health services, and the annex in that had a very helpful set of over about 4 pages of issues, bullet point issues, to be picked up over the next 6 weeks. And I thought it would be really useful if, as a health committee, we could use that annex as a kind of an aid memoir to ask the NHS to come back and report to us on, whether it's in the confines of this meeting or whether it's simply by email, but I think this meeting would be quite useful to have a report against each of those issues that Sir Simon's letter has picked up, so that we can consider and discuss the response of the NHS and how it's picking up all the issues that he's identified. And I was very much hoping that that would be something that we could see from the NHS in 4 to 6 weeks as it gets to grips with those issues.
Thank you, Lorna. Liz, would you care to respond to the first instance?
Yes, happy to. This is absolutely a national concern. I don't have good data on this, Lorna. The health system, the CCG, would need to be approached for that. But certainly aware of it and aware that the CCG and health system has been running a campaign recently to encourage people who need urgent or emergency care to come forward and to encourage them to use the NHS. And we've played a small part in that campaign as well as colleagues from the council. I have seen the Simon Stevens letter that you refer to. It is very comprehensive. It is about recovery into phase 2 of COVID-19 for the NHS. And I think we can certainly raise your request with the clinical commissioning group. They do, I think Kate may want to come in on this. The clinical commissioning group do provide information, I think, on a weekly basis, which comes out as an update on what's happening. And if you would want a focus on the annex of the Simon Stevens letter in that update, that would be fine. I think in terms of inviting NHS officials to these meetings, it might be worth talking to Kate about what's going on around the region, because there has been some pulling back on that because of the very intensive workloads of everyone concerned. So I think we would need to approach the CCG and look at the best way to do that. But certainly they will absolutely be working on that. So in some form or other, I'm sure would be happy to provide an update. Kate, do you want to comment on what other areas are doing around NHS?
So actually, from a regional perspective, the scrutiny of the NHS has, scrutiny officers have been letting the NHS get on with the emergency response. There is an expectation that we would start to scrutinise as we get more into recovery, but the way that we're doing it is as informally as Liz has suggested, by asking those questions through the information updates that we get. So I can certainly kind of feed that back to the CCG and see if they can respond to some of the questions and the updates that you required in the Simon Stevens letter. But generally speaking, we're letting the NHS kind of from a scrutiny perspective, letting them actually deal with the incident at the moment before we kind of take their time away to respond to scrutiny.
Thank you very much indeed, Liz and Kate, very helpful. Lorna, would you care to come back, please?
Yeah, just to be clear, I'm not asking for people who should be doing other urgent things to come and spend their time here for hours talking to us about it. But I think bearing in mind that there is a ready-made annex from Sir Simon Stevens' letter, and bearing in mind that providers will be providing and the CCG will be planning for all those issues anyway, I hope it would be useful just to have an update against how each of those is going, for us to see and potentially to discuss and to take back any issues back to the CCG if we want to raise them, but not, I agree totally, not to ask them to come here sort of, you know, in large numbers and spend their time talking to us. I agree entirely on that point.
Yes, that sounds very reasonable, Lorna. Either Kate or Liz, do you want to respond to what Lorna said?
I'll just take that back to the CCG for you.
Thank you very much. Lorna, anything further, please?
No, thank you. Thank you.
Thank you very much indeed for keeping all of your questions very relevant to the subject matter in hand. Next on my list, I had Councillor David Connor, but he seems to have taken his hand down. David?
Thank you, Chairman. I won't elaborate too much on because on Councillor Lorna Dupre's question regarding PPE. It was primarily the question I was going to ask and the answer really was given was really acceptable to me, Chairman. So I won't elaborate, as I just said, and I'll give other people a chance. Thank you very much.
Thank you very much indeed, David. Councillor Linda Jones, to be followed by Councillor Lucy Netzinger. Councillor Linda Jones, please.
Thank you. It's been a very interesting and informative discussion so far. I think the early focus, about half the meeting, is focused on care homes issues. And indeed, the questions that Councillor van der Ven asked resonated very much with the questions that residents asked. And I think that there is a little bit of an historic element to this, but I think residents got extremely rattled by the discharge to assess policy. And they were very concerned that people were being discharged from hospital into care homes, and inadvertently they might carry that virus with them, they might be asymptomatic, and there's a real worry, and we haven't got to the bottom of this yet, that actually some of that spike in care homes may have been related to the discharge to assess policy. Now, that was done for the very best of reasons. It was the beginning of a pandemic. They were trying to clear hospital beds, etc., etc. But I do think we ought to acknowledge that while we're thinking about all the things that have improved since then, that actually local residents have been, my local residents, and I'm sure others, have been very, very concerned about that. So that's the first general comment I'd make. The second one I'd make is about this meeting. This is very, very welcome as a meeting. We do get a lot of reports, weekly, bi-weekly, daily, etc., etc. What I think has been difficult is to have a forum where we can discuss these issues, where we have our Director of Public Health for Cambridgeshire and Peterborough, where we have that sense of public health connected to a regional and a national picture, which we can then understand more about. And I think a forum, and using this committee as a forum, is going to be really important as we go forward. Now, Liz is absolutely right that she can't by any means answer everything. She's got to hand a lot of stuff on. But if we haven't got a place where that can all happen, then public health is not doing its job. And she's quite right, she is doing her job very well, which is to say public health stretches across all policies. Public health is an issue for all parts of the local authority. So I wanted to make those two comments before I started, because it's really striking sitting through the first part of this meeting. I've got 4 areas that I'd like to explore, if you would indulge me, please.
Apologies, Linda.
Yeah.
Well, thank you for muting your phone. Linda, do you want a response to be made to your first 2 points, and then we can come to the next 4?
If you like, yes. I was really making a comment rather than necessarily expecting a response, but very happy to have one, of course.
Well, thank you. I think that the first 2 comments you made were really, really useful ones, and I want to give Liz particularly the opportunity to respond to those.
I think on your first comment around the discharge to assess policy, I would just say that I'm aware that Public Health England has been carrying out a lot of research into, very real-time research into the issues in care homes and the best ways to prevent spread and to mitigate the increase in cases in care homes. So it may be that, I don't know, Linda, because I'm not at the centre doing that research. Obviously, I'm here, but I think it will be useful to look at the research that Public Health England has done in care homes on the factors that are leading to transmission of infection, and maybe we'll have some more answers once that's available. So I think that's the main thing I wanted to say, really. And I absolutely agree with your second point that the whole council is making a public health response at the moment, and very much working as a public health organisation, as is the system. So yeah, thank you.
Thank you very much indeed, Liz. Right, Linda, your question.
Thank you. The first one I think is about the stock taking, because we know, because we are now getting quite a lot of information about the shielded list and about the most vulnerable residents. And we know that there are quite a lot that the Coordination Hub still has not tracked down. And I think understanding how that can be done is going to be really important. I mean, these are people who have been asked to self-isolate for 3 months. I know of at least one case where a very elderly resident stopped taking her pills because she said, well, if I've got to isolate for 3 months, what's the point in going on? So people are scared, people are worried still. And those are people we know about. There are other people who are not online, who haven't got apps, who haven't got a smartphone, who may not even have a working phone. And it is very difficult to reach those. One of I think the concerns I've had is that I don't think we've made enough use of local organizations in reaching out. I mean, I've started to use a lot of residents associations because actually resident associations know their neighbours very, very well. This is going to vary across different parts of Cambridgeshire. But it relates to another issue that has worried me, I think, from the start, which is that the response to COVID, absolutely understandably, initially, has been very, very top-down. And I would like to ask whether earlier and better coordination between the national effort and the expertise that sat in local government in terms of knowing their populations, knowing what needs there were, might have actually helped us to move forward rather faster. In the end, I think we've got to some of those places because there has been a lot of local authority expertise recently being drawn on. But I do worry that we've missed a trick really with this in the early days through having grand policies, but not using our local authorities wisely enough. And I do reflect on the Association of Directors of Social Services and local authorities associations and so on, all of whom are saying you still could be using your local authorities more than you are. So that's my first area of questioning.
Thank you, Linda. Liz, would you care to respond to that?
Thank you, Linda. I absolutely understand what you're saying, and around people on the shielded list who haven't been tracked down. I know that that is a real area of concern for our COVID-19 hub, and a lot of work is going on in order to address that. Data sharing work, trying to visit people. I think we're using, again, the local authority resource because we can be out there on the ground. Clearly you don't visit and go into people's houses, but actually door knocking if we can't get in touch with people any other way. I think absolutely that is all very current and really needs, again, this is a question, Linda, that I will need to refer to Adrian Chapman because this is absolutely core to what he and his team are doing at the moment, working with the shielded list and trying to make sure that everybody is supported appropriately. And absolutely that does work with our district coordination hubs, who in turn work with local voluntary sector and other associations. So I will hand over to Val also because she works more closely with Adrian. So she will have further insights into this. But I know in terms of Adrian's reports into the senior management team and into the strategic coordinating group, he and his team are absolutely focused on ensuring that people in the shielded group are reached and that is done effectively. So I think Adrian would also be best placed to comment on the coordination between the national and the local responses. It has been, you know, obviously introduced at a rapid pace, necessarily dealing with the situation. So I'm sure that there are lessons to be learned, but I think it's Adrian who would probably be able to give you the details of that. So I think this is one, we'll record it in the minutes, but this is one which we'll need to refer on. And I'll hand over to Val at this point.
I hope you can hear me. Yes, there has been a lot of work that has been undertaken so far, but also an acknowledgement that there's more work to be done. Tom Barton, who heads up business intelligence team at the County Council, has been working to develop a model, and I've had numerous meetings with him trying to identify possible sources of intelligence. It's particularly relevant to shielded people who fall into the socially excluded or vulnerable groups, which don't have the traditional contact like registered with a GP, etc. So there's that side of it, which is of particular interest to myself. But there is in fact a paper going to the community reference this afternoon where I'm going after this meeting, which is particularly addresses your questions, Linda.
My apologies. Where was the paper going? I didn't quite catch that.
Community reference group.
Thank you.
And Tom is leading on developing and improving the data collection and management by using different sources.
Thank you. Linda, do you want to follow up on that, or do you want to get to your second question?
Well, just to follow up on that, I would say that I have had various exchanges with Adrian Chapman, who I know is working extremely hard. And I know he has found, in a very even-tempered way, he has found significant frustrations in terms of people falling into gaps, of national delivery not happening, of the wrong, you know, there's been a whole set of things. And we need to acknowledge those openly as a local authority, because moving forward, having the trust of our residents is going to be extremely important. Liz said right at the start that, you know, the residents are the key to this in terms of having confidence that we know what we're doing and that they therefore can trust what is being said. So acknowledging some of these things haven't quite been right is a really important thing to do. Can I go on to my next question, which actually picks up a question that Lorna raised about the testing and the tracking. And what I had wanted to ask was, what was Cambridgeshire County Council involvement in the test, track and trace plans? I think Linda Sheridan had answered that in terms of these 3 tiers. And I have to say the 3 tiers make me slightly worried, because I know that the districts and the city have expertise through environmental health officers and others in terms of tracking. They're very used to that kind of tracking. I'm really concerned about a sort of national volunteer force that's doing tracking that isn't under the control of local authorities and that doesn't dovetail with local authorities, because we could be in the same situation as we were earlier with the coordination hub, where mixed messages are going out, mixed volunteers are going out, people are getting rung up 3 or 4 times, etc., etc. All this has happened. I know you had reports from residents, and we can't afford for that to happen in test, track and trace. So I would like to know about, I would like to be more confident that local authorities, and particularly directors of public health and directors of public health, the specialist public health people, have been intimately involved in the development of this and have a certain amount of authority and control over how it rolls out in our local authority and indeed across our region.
I think that's a very helpful question, Linda, especially the coordination with the districts and city. Linda Sheridan, would you care to respond to that?
Yes, my apologies, and I probably have misled you slightly in thinking that we're not involved. We very much are involved, and there is every intention to make full advantage of the great expertise that environmental health officers have. So when I talk about the more local aspect, which is likely to happen on a more is likely to be recruited at a regional basis, but there will be very much local input, and we have our own Cambridgeshire and Peterborough. It's now an LRF subgroup, which is meeting to oversee the process across Cambridgeshire and Peterborough. That group is jointly chaired by Sue Grace and Sue Graham from the Clinical Commissioning Group. I'm on that with one of our registrars for the public health aspects of it. And Val Thomas is also on that group, because we recognise that one of the major issues we may have with contact tracing going forward will be contact tracing among the more vulnerable populations, the harder to reach populations. So I think I've probably gave the wrong impression to start with, and I didn't mean to do that. But I think we will have quite a strong local input to this, and it will come in from the public health team and from others in the county council and in the clinical commissioning group.
Thank you, Linda Sheridan. Linda Jones, would you care to ask?
Yes, thank you. I mean, to be fair, I mean, you did talk about the 3 tiers. So you absolutely did mention it. What I wanted to be clear about, and I think you have helped a little bit here, is to have more confidence that the control that's being exerted is not a top-down control. The control that's being exerted takes into account and uses in a creative way all the local and authority expertise and the expertise there is across Cambridgeshire in terms of doing this kind of work. And I think you have reassured me to some extent. If there is more information available on how this works, I think it would be very helpful for the whole of the Health Committee to have that information going forward, because, you know, again, it helps us to have confidence. If we want residents to use an app, or we want residents to be involved in this, we need to make sure they feel confident that their local authority knows what it's doing, as it were, and has some control. So that was just a general comment. I have a couple more questions, if I may, Chris.
Of course.
The next one is really about, it's coming back to the stock take, and I think it's probably a question for Val, which is unfortunate because her audio is really bad. But there was a question from a resident right at the beginning about learning disability. And we've been focusing on nursing and residential homes and older people. But of course, there are a lot of younger people who may have learning disabilities or other health issues, which means they're living in group homes. Now, we know that if a case of COVID arises in there among a member of staff or a visitor who brings it in, we know how quickly it can spread. In a group home, which may be 5 or 6 rooms sharing facilities of various kinds, it could spread very quickly. So I'm just wondering if Val could reassure that particular resident who's got a relative in the home that the kind of safeguard and PPE safeguards and advice and guidance and support that's being now given to care homes is also being given to group homes. Because of course the local authority is actually, we're putting people in those group homes. So we have, as we do with buying the beds, we have responsibility.
Liz, would you care to comment on that first?
Yes, I'm not absolutely sure that Val's work will be covering group homes, which I think would be more linked with our adult social care, our work with the Adult Social Care Directorate. So I think, Linda, there was an earlier question on this, and it was referred to the Adult Social Care team. I'm very aware that they do very much engage with this group through the Learning Disability Partnership, and I think we will be able to give you that reassurance. But I would like that to be from the Adult Social Care team, who are very closely involved with this, because they can give you the detail which you need. Very happy for Val to comment, but I think her work with the vulnerable groups is not necessarily with this particular group who are in group homes and receiving that type of support. So that's why I just wanted to comment first.
Very helpful, Liz. And when further information is available, please do ensure that it goes to all of the members of the committee, not just to Linda, because I think we'd all be very interested to hear. Val, did you need to add to that at all?
Just to add that where there are other places such as bed and breakfast accommodation, the sleepers accommodation, the approach that you just described, we have applied there in terms of identifying the needs to ensure that people can social distance and they can self-isolate. And that's the type of needs assessment that we're doing with vulnerable groups that are staying in those types of shared accommodation.
Thank you very much.
Provide the appropriate support and advice.
Thank you. Linda.
Yeah, could I just ask Val in relation to that? If that's the definition of vulnerable groups, have you done quite a lot of work with homeless people? Because of course one of the things that districts and particularly the city has done is to move homeless people quite quickly, providing they're comfortable in moving into hotels and into places where they can be sheltered. Is there then a public health remit to go into those hotels and to sort of give advice and support and guidance? I mean, what is the relationship there? Or is that something that's left to the districts and city?
There's a requirement that the district authorities or any authority for them to offer housing for all their sleepers, and all the districts have complied with that. And there was also a requirement that there was a cell or homelessness cell, which would cover the whole area. That requirement has now been met, and the housing board takes the form of the cell, assume the responsibilities, and the districts are working collaboratively to ensure that the requirements around the public health measures, whether that's sort of social distancing or hygiene measures, are met. We supported that initially by providing a template, and this has been carried out across all the districts. We initially applied it in North Lower County to identify what the needs are, and that is now being taken forward by the Housing Board with all the districts working collaboratively together.
Right, thank you very much. And my final
also on that board, we've also co-opted on ourselves the public health, but also the CCG and other services which would contribute to the efforts to meet the needs of the sleepers that have been housed in that accommodation.
Right, thank you very much. And I mean, I think it's going to be really important going forward. If we're talking about a new normal in lots of other ways, then this is a real opportunity, is it not, to having reached out to very vulnerable groups and excluded groups like the homeless, to actually be able to kind of move forward with a policy response. And that's going to be an important thing. And I'm not expecting you to kind of have it now, but it's going to be an important thing across the council, across the districts, across the city, to be able to coordinate something like that, which, you know, could be part of a wider anti-poverty strategy. So my final question, well, it's really a comment, because I think Councillor du Preez, Lorna was probing a little bit earlier about the spikes and different rates in different parts of Cambridgeshire. And I had a question related to that, because there is some evidence coming out now, and it's been particularly marked in London, in relation to the way that the pattern in COVID-19 mortality is related to other types of mortality. In other words, that COVID patterns of mortality are related to inequalities in health. And I think that's a really interesting, I'm not expecting you to have done that analysis yet. I'm sure it's something that will happen in the future, but I think it would be useful to know if there was emerging evidence across Cambridgeshire of the pattern of morbidity and mortality reflecting other patterns of morbidity and mortality, and both of them reflecting in their turn inequalities in health. Because of course, as a committee, inequalities in health is a major issue for us. One of the areas where we've been in particular, and Val will know this better than anybody because she's led on it all, one of the areas we've been particularly looking at and involved in and investing in is Fenland. And I think understanding that pattern of mortality, morbidity, will be extremely important as we go forward. So if you have any comments to make on that now, I would very much welcome them.
May I ask Liz, first of all, if she's yet seen any local statistics which would tend to support the suggestion which is being made by Linda, which is a suggestion that we are seeing in other parts of the country, but not uniformly. There are some areas which do not have problems with health inequalities, which do have quite high levels of mortality, unfortunately. But Liz, as far as the local area is concerned.
I think, again, it's a very good question. What I would say is that we are at very early days at the moment. So we do have the mortality statistics for deaths up until the 17th of April. And I wouldn't say that in the area, those showed a very strong correlation at that point, but the data has come in today from the Office of National Statistics. I haven't had the chance to look at it yet on information up to the 24th of April. So I think, Linda, the right time to answer your question will be a little bit further into the future when we have more of the information that covers the plateau in COVID-19 that we've seen. So a good question, and we will look at that and we will get back to you.
Thank
you, Linda. Would you care to follow up on that?
But just to say, it would be extremely helpful to have that as a report to a future meeting. Could I just say in general terms, I mean, one of the messages that's coming through from quite a lot of speakers about recovery and moving to the next stage is about the learning. And I do think, although, you know, CCG and the trusts and so on are extremely busy at the moment, they will also be doing a huge amount of learning. And I think the more swiftly that can come out and be distilled, in particular by the public health team that will have this overview, the more important it will be, and the quicker it can get back to be heard about by the health committee and discussed by the health committee, the more effective we will be. So I do hope that work happens quickly.
Okay, thank you.
Yes, thank you, Linda. And on the request for further information about mortality and the correlation between mortality and other issues, other conditions, may I just suggest that we do take care to separate out those deaths which occur in care homes from those which occur outside care homes, because we might find quite a different perspective given if we do that. Right, any further questions you've asked at all, Linda, or has that finished all of your questions and all of your follow-up?
I have got, but no, I've had enough time, so like Susan, I will bow gracefully out and move on.
Okay, there will be nothing stopping you coming back later in the meeting if you so wish.
Thank you.
Councillor Lucy Netzinger. Lucy.
Thank you. Given the time, Chair, I think I'm going to try and ask all three of my questions in one go. Okay. Before I start on that, I do just want to go back to the very beginning and echo what Liz said at the very start of our discussion on COVID, which is to say a massive thank you to all the county council staff, but also all the staff across so many of our partner organisations who have been putting up with and coping with a huge amount of additional work in managing this. I think it's really important to remember just how many different levels of and different parts of the community are having to change the way they work absolutely enormously. And while there are things that we're getting wrong, I think it's really important to recognise that's in this system of enormous change. So if I say some things that come across as slightly critical in a minute, it's in that context of a massive thank you to the staff across huge numbers of organisations who have picked up these changes and put in a huge amount of time. I do have, as is the case with lots and lots of the questions, big concerns about what's been going on in care homes. And I want to pick up what Linda was talking about the discharge to assess policy. One of the things that worries me is that there was a sense just now that that was being talked about in the past. While I'm aware that there are still people who are being discharged from hospital back to care homes with suspected COVID, and that just should not be happening. It's dangerous. It should not be happening. Those people should not be being discharged from hospital back to care homes where they are not able to be looked after safely. And I think it's really important that we are aware that that is still happening, and that so I want to know from Liz what is being done to make sure that that is not happening, and what changes are being undertaken in hospitals to make sure that that is not happening, because it really, really shouldn't be.
Lucy, my apologies for interrupting you, Lucy. That's such an important point. I wonder if it could be taken by itself before we get to your other 2 points.
Okay.
Liz.
So on all of this, we look very closely at the national guidance as to what is the safest way to do things. So on this one, we would absolutely follow the Public Health England national guidance on what's needed. And I think we need to go back to that because clearly everybody is tested now before they go back to a care home. It's recognised that residents of care homes may have a more prolonged period of infectivity. 14 days is often applied rather than the 7 days, which is applied for the general population. But care homes are people's homes. So I'm not going to make an absolutely clear statement here. I'm happy to go back and discuss this with Public Health England and others. We absolutely need to make sure that things are done safely, but we also need to look at the research on what is causing the issues in care homes and give the right system response to that. So that's what I'll say for now, Councillor Netzinger, that we need to be very much in tune with the national research that is coming out and taking all the recommended measures to keep things safe. Because everyone wants to do it. No one's working against that. It's just the way to do it that's important.
Thank you, Liz. Lucy, would you like to follow up on that particular point first before going on to your next questions?
Well, I think it feeds into my next question. I'm switching 2 round. So the next point that I wanted to make, or was going to make at the end, is that I think it's really important that we have the NHS here in this meeting to be able to ask those questions of them. And I was slightly concerned by what was said by Kate about the fact that we're not going to, that there's an emergency and we shouldn't be doing scrutiny. I think it's really important that we get the NHS here to be able to have these conversations with them in the room as well. I would like to make a plea to you, Chair, to make sure that at our next meeting, we do have representatives from Addenbrooke's, from the Mental Health Trust, so that we can have a discussion with all of these people. Now that we have these meetings in virtual format, it shouldn't have to take the whole afternoon. They don't need to be here for the whole meeting. But I do think it's important that we have the opportunity to ask our reps, as the Health Scrutiny Committee, to ask those health organisations some of these questions and to have their answers transparent for the public, because I think making sure that we have transparency in decision making is one of the key issues for making sure that there continues to be the level of public support that there has been so far, for and a sense of confidence in the way in which this all of this is being handled. So that was my second, and the third point that I wanted to make, which is also wrapped up in that, is to do with support for the, families of those with mental health problems. It feeds into the question that was being asked at the very beginning about support for those with learning disabilities. I'm very, very concerned about the level of support that's being given to carers who are having to manage at home, potentially with family members with mental health problems, and also about the level of testing that's being made available to people who may not be as switched on about symptoms as the general public. So and those questions, I suspect, are questions that need to go to CPFT, the Mental Health Trust, at least at some level. I can't ask them to CPFT because they're not here. So Liz may be able to give me some feedback, but I think it's important that we have them here at the next meeting so that we can get better feedback on how they are managing issues of supporting people with real mental health problems and in their homes. So
thank you very much
two
indeed.
questions, one to you and one to Liz.
Thank you. I'll let Liz answer the question first, the second question, then I'll come back to your question. Liz.
Okay, so I think your second question was really more of a comment on the situation and on public confidence. And I would say that the NHS is absolutely engaged in supporting the response in care homes, and the CCG chief nurse is chairing the daily work to support care homes, and they are putting a lot of resource in. I know that wasn't quite your question, but I just do want to emphasise that this is a very joined up response with the NHS. In terms of support to carers for people with mental health problems, there is a multi-agency mental health group which our public health consultant Kathy Hartley attends as our lead for mental health. And I know that support for people with existing mental health conditions, which would also include their carers, I'm sure, in the community in these circumstances, is one of the parts of that plan, and CPFT is involved in that group. So I think, Councillor Netzinger, if you want to, in a sense, either have us take your question from the minutes or send in a question, we can certainly contact CPFT through that joint group and provide a fuller response to you on what's being done.
And in answer to your first question, Lucy, more than happy to take this back for further consideration and for it to be discussed at the next Leeds meeting. It may well be disproportionate to have representatives at our next meeting from CPFT and the CCG and each of the hospital trusts. But I think that it is quite appropriate for us to delve where we most need to. So if we take that back for further consideration with officers, and we also discussed at the Leeds next Leeds meeting, then I'm sure at the next meeting of the Health Committee there will be some representative from at least some part of the health service to be able to answer questions. But I think we need to discriminate rather than necessarily invite every single person from each part of the system. Lucy.
Thank you. Yes, I understand. Well, I think that there are distinctions between the CCG, the acute hospital sector, and CPFT, and I think they all have a part to play, and we need to be able to get a response from all of them. The other thing that actually it would be really helpful to get a response on would there've been quite a lot of discussions during this meeting where you've said, yes, we'll get an answer back and we'll circulate it to all the members of the committee. And I think it might also be very helpful if those answers could be published alongside the minutes, unless there's anything particularly confidential there. Because I think as part of this importance of openness and transparency, to make sure that people can see that there have been a huge number of questions that have been that we're going to get responses to as members of the committee, and I think it's important that those are in the public domain, not just coming to us.
Obviously, we will need to be very careful to ensure that there is nothing in those answers which in any way shouldn't get into the public domain, but almost by their very nature, the fact that they would be given to all members of the Health Committee would suggest that we would be being very careful to ensure that they don't contain any personal information or anything which is inappropriate to get out into the public domain. I personally am more than happy for that to be adhered to. It's a very unusual situation that we're in at the moment. Public confidence is very important. So in this very unusual circumstance, I think it would be appropriate for us to addend the answers which are being given to the various questions to the minutes of this meeting when they are produced and when they are circulated.
Thank you. That's great.
Right. I do have Lucy, I take it you finished now? In which case, please do take down your hand. Thank you very much indeed. Val, you wish to have a word? Val, you're muted.
No, I don't. I apologise. I'd be very remiss if I didn't take my hand down.
Thank you very much indeed. Kate Parker, you've raised your hand.
Yes, thank you. I'm sorry, it's pretty much to concur with what you've just summarised, Councillor Bowden, in regards to taking the scrutiny. I'm sorry, Councillor Neffsinger. I didn't mean we shouldn't scrutinise. I think it was just at this moment in time. So I think that the approach that Councillor Bowden has suggested, in that we actually think very carefully at the next advanced chairs briefing and leads members briefing as to the focus of what we want to ask, and invite the NHS colleagues in with appropriate questioning. So it's just that it was just to kind of say the immediate response from the region scrutiny officers was not to distract the NHS at that particular point in time, but not to say that we shouldn't scrutinise.
Thank you, Kate. That's very helpful. Councillor van der Ven. Susan, you are muted.
There we go. Yes, a very short matter. I think I just wanted to refer to the COVID-19 reports in children's and adults commissioning on the mental health arena. And I know that these matters will mostly be for CYP and adults committees, but simply to acknowledge the, dramatic increase in mental health suffering as a result of the lockdown and of the pandemic, and that we will, of course, expect to see this reflected in our own work, in health committee work. The very first week of the COVID-19 highlight reports in the Children's Commissioning report, there was some information about referrals into CHUMS being down 85 to 90% since schools closed. And the CHUMS clinicians were working through 700 young people on the waiting list at a rate of about 50 per week on virtual face-to-face counseling. So the scale of concern is really hard to not take note of. And I just wanted to sort of state this for the record. I did contact Liz about it, and we had hoped to discuss it earlier and agreed I would just raise it today.
Thank you, Susan. I think that's a very valid point to raise, and it's one which I think concerns all of us. And the longer term implications of what we have been through and continue to go through are ones which I think we are going to be having to deal with for a very, very long time to come. But a very valid point for you to make. Would any other member care to ask any questions or make any points? If there are no other members who wish to speak, then I would like to move to the recommendation, if no one objects. And my recommendation is, the recommendation we have in front of us is to note the contents of this report. I take it that no one objects to noting the contents of the report.
Noted.
No one objects, that's good, so I'll take that as being noted. Thank you very much. My apologies if that took a long time, but I thought that the points which were being raised were important ones, and it really was important to follow that through and let people have supplementaries and supplementaries to their supplementaries where necessary. All of the questions which were being asked were highly appropriate ones.
Thank you, Chairman. Yeah.
Right, move on to agenda item number 7, which is the Health Committee Agenda Plan. And may I invite the Democratic Services Officer, Dawn Cave, to introduce this item.
Hello, Chairman. Just very briefly to highlight that all of the meetings we've got scheduled in the coming months, including the dates that were originally provisional, so the dates in June and August, for example, the Health Committee will be meeting, and it will be considering a COVID-19 update at each of those meetings.
Thank you very much indeed, Dawn. Does any member have any question? Any member wish to raise a question or make a comment? Please raise your hand. No one? Then we're being asked to note the content of this report, and I assume from the lack of Councillor Linda Jones.
Sorry, I just wanted to check in relation to, I mean, it's very, very commendable that the COVID-19 reports are coming each month to our committee. I wondered if there was scope to kind of slightly shift the balance, because about 2/3 of the paper is, I mean, some of it is very, very historic and could disappear. Some of it is fairly current, and the service response is what really we're interested in. And having a service response that's as broad as possible is particularly important. So I just wondered if there are problems with doing some of the learning in separate papers from different parts of the health system. Is it something that could be put into a monthly report and therefore kind of ease the burden to some extent on the other organizations? I'm just thinking of trying to get information out as early as possible, as quickly as possible, obviously as accurately as possible, but not having to wait for a long time to get information coming back to us.
Thank you, Linda. Well, we always have the facility for information to be passed over to members when it becomes available, and I'm sure that will continue to happen. This first report that has been produced, almost by its very nature, will have needed to have had more historical information in it, providing the background than would be the case for future meetings. And I don't anticipate the future reports which come on this particular agenda item in future meetings will have quite so much historical information. And I think you're completely correct. The emphasis does have to be on the service delivery and on reports on that. And I think the right place for us to deal with that in greater detail would be at the Leeds meeting, where lead members can manage to go into somewhat more detail about that, to make sure that we get the balance right. But you're entirely correct, the balance will need to change as we move through over the course of the next few months. Councillor Van der Ven.
Thank you. Apologies if I missed a word or two in your preface to this section. We need, I would think, to have a sense of how we're going to reintroduce our scrutiny function. I know we've discussed that a little bit, but our forward agenda has transformed. You know, it was packed to the gills, really, and a lot of the stuff that we had planned to do has understandably needed to be paused and put aside. But so it's just to make the point that we perhaps we'll be discussing at lead members how we might begin to reintroduce the scrutiny function and our other looking at the any delayed contracts and so on.
Thank you very much indeed, Susan. You're entirely correct. We do have two functions within this committee. The first is a public health function, and the second is a health scrutiny function. And as has already been explained, now is not the time necessarily to be calling out people from the health service in order to undergo a large amount of scrutiny. Having said that, you are correct. We've got dates for meetings in the agenda going up to September, and no scrutiny is contained within that whatsoever. So your suggestion is the entirely appropriate one. When we come to members' leads meetings, we will the next one we will have that discussion, and we will see how we can reintroduce health scrutiny into the agenda. But going back to the point made by Councillor Netzinger previously, I think it is pretty important that we do give priority to some of the items which relate specifically to COVID-19 because of the immediacy and emergency of that particular subject. So getting back to business as usual, so far as health scrutiny is concerned, may take some time, especially if we wish to prioritise items which directly relate to COVID-19. Any other comments or questions from any members? So I take it that members are happy then, if no one objects, that we take that report as being noted. And that was the final item on the agenda. So thank you very much indeed, members, for your cooperation and your discipline in this meeting, and very many thanks to officers as well for the answers they've been given. And as this is the final item on the agenda, I'd like to express my thanks to those members of the public and the press who've taken the time to watch the meeting today via the Council's website. This broadcast will now end. The committee is due to meet next on the 25th of June 2020, and the arrangements for that meeting will be confirmed nearer the time in the light of the emerging situation. Thank you very much indeed, members. Thank you, officers, and thank you, members of the press and public.